Disclaimer. The discussions and personal opinions of the guests do not replace professional advice. It's recommended that you seek your own independent professional mental health or legal support to meet your individual needs.
Average neurological structure and function.
Joseph and Nimasha, welcome to Life in the Psych Lane. It is such a pleasure to have you on again, Joseph. It was one of our most popular podcasts that we had last time. And then Nimasha to come on for the first time. It's such a pleasure to have you both.
Thank you so much.
We have a really exciting topic to talk about today. It's about neurodiversity and the program you've developed, which is Neurodiversity-Affirming Dialectical Behaviour Therapy. It's DBT basically for the autistic population. It's been an amazing program, which we're going to dig deep into. Let's do a bit of a brief overview first around neurodiversity and neurotypical. We hear this a lot in our profession. We speak about it, but can we simplify what we're actually talking about for our listeners?
That is so valid because these terms get bandied around a lot. Joseph, jump in if I miss anything. But in my everyday work, neurodiversity is the range of differences in individual brain development and function and behavioral traits that are kind of seen as part of normal human variation in the population. Neurodivergent in particular is sort of somebody whose brain and neurotype sort of diverges from expectations and standards of, neurotypical functioning. Mm. Whereas neurotypical is somebody who sort of has average neurological structure and function. And neurodivergent is kind of seen as an umbrella term. So a lot of people think about particularly autism and ADHD, but it actually kind of is an umbrella term for a lot of things, including sort of bipolar disorder, OCD, CPTSD, learning disabilities, all of that sort of stuff.
Wow, that's such an interesting add-on there in there, just, so that we are covering the right diagnoses under the umbrella term.
100%.
Yes.
Well, I guess for both of you then, we talk about neurodiversity-affirming practice and we bring that in there. And obviously as professionals, as psychologists, there's added training for that. What is your interest around working with neurodivergence or neurodiversity-affirming practice?
Yeah, well, So for me, I'm autistic myself. I was late diagnosed. I figured that out in my sort of early to mid-20s. And that, as it does for many neurodivergent humans, it sparked me deep diving into all of these concepts. I was already on my path to becoming a psychologist. I had just kind of started my master's program. And lo and behold, my interest in trauma therapy springboarded into an interest in neurodivergent affirming therapy and has kind of just really evolved since then. And then I got connected to Joseph and he really opened my possibilities into a lot of things as well.
Yeah, it was like serendipity, right? So
yes.
So for
What's
me,
your interest, Joseph? Because I know when we spoke about last time, obviously we have a background in the forensic disability side and you've developed programs nationwide. So, what is your interest in the neurodivergent population?
Yeah. So I've worked in the area of disability, particularly forensic disability and mental health for the past 25 years. And that means I conduct a lot of assessments with autistic clients and ADHDers and clients with complex presentation, as we've mentioned before in the previous podcast around personality disorder, mental health, and offending. And in the past 5 years, given kind of the changes that's happening and the developments in the area of neurodivergence, and considering that I do work with autistic clients and clients diagnosed with ADHD, then I realized that, I have to be I really have to upskill myself and learn, kind of the developments in this particular area, right? So for me, it was really a learning experience. And then, of course, I started attending workshops on, that consider, neurodiversity affirming approaches. And considering that I've worked in the area of dialectical behavior therapy, I also see the value. What's interesting is, of course, the change over time in terms of my practice from, you know, 20 years ago when you use applied behavior analysis. And then you realize that, oh my gosh, and it's kind of cringeworthy now that you realize that, oh, but it's more about being responsive and reflexive in acknowledging that, the need for change. And I think that's the reason why I'm really excited in developing a more neurodiversity affirming kind of program to make sure that we are responsive to our clients' needs, so our neurodivergent clients' needs. So
Correct. We were just speaking about before, so much of the work is around educating clients of their presentation and diagnoses, because they might receive a diagnosis, let's say, but they don't get information about their own functioning. And, we're looking at in the neurodiverse population, it's the camouflaging, the, sensory sensitivity and cognitive inflexibility, some of those things, which I know that you've taken into your work and your practice and taken into consideration and then developed this program. Do you have any interesting nuances or things that you've noticed in your client cohort of the neurodiverse population that you can share with us?
Yeah. I think there's a lot that comes with working with neurodivergent clients. I recently did finish up my master's and I'm now kind of doing assessment and therapy almost full time with autistic and neurodivergent clients. And I think one of the big nuances that I'm seeing is recognizing the layers to masking and the sort of the journey, especially with late diagnosis and especially with regards to women, the journey of sort of figuring out what neurodivergence and particularly what being neurodivergent means to the individual, because it can be
yes.
such a broad ranging label and umbrella term. And I think some of the nuances in there are also about, as you said, like it's such education can be such a major focus in the beginning because there's so much that we don't talk about in society about being neurodivergent, and there are so many nuances and elements and little bits and pieces. And I've started talking to clients about how without the label of neurodivergence, some of the elements of being neurodivergent seem wildly unrelated. And
Yes.
it is not until you kind of put that umbrella on it that you realize, oh, so wait, my inability to drink a glass of water without spilling it on myself, that's because I'm autistic? Wild. And there's a beautiful layer of like self-understanding and self-compassion that comes with that experience of recognizing that we're neurodivergent, because all of a sudden all of these things that we're told are wrong with us in society are natural and a part of our neurotype, and that's a beautiful thing to recognize.
Correct. I so love that because, if we can get into the everyday kind of detail of it, some of that masking and camouflaging behavior is what an autistic person may be doing to essentially fit in.
Mm.
If you were giving real life examples, like what kind of things do you see, what would relate to the, like you said, in terms of drinking water and that personal challenge, what other examples would you say are things that you also see in terms of masking and camouflaging behaviors?
Yeah, Joseph, you probably also have far more experience with clinical work than I do, but I'll start off. I think masking can be so many things. Um, it can be all the things that you kind of at a surface level think about, like, it's uncomfortable sometimes for people to make eye contact, so forcing yourself to make eye contact is a really key
Yes.
one for a lot of people. But also it can look like um, pushing through sensory discomfort of
Mm.
um, you know, appearing and forcing yourself to kind of appear how you expect you're supposed to. For me, I've seen a lot of clients start to recognize, like, oh, maybe I don't have to wear the clothing that slowly drives me nuts in the back of my head, or, force myself to make small talk, or not get as excited as I want to about the topics that I'm interested in. There's a whole lot of things that come under masking. And one of my favorite things is also just the freedom that can come with unmasking. I like to kind of, the way I've articulated it to people, especially now, I've had the privilege of being able to unmask in my own practice because I am unmasking with clients on their journey to unmasking as well. And the way that I've described it to people is, if you wanted me to sit here, like straight legged, back against the chair, like not moving my hands for the entire therapy session, I can do that. I can be that therapist. I have that ability. However, I'm going to be way more exhausted by the end of that session than I would be if I was sitting cross legged, letting myself play with whatever sim toys in my hands and just allowing myself to do what my body and my brain naturally present as.
Correct. I'm going to add in there, I've got a really funny comment that was made last week in our group, but it was a neurodiverse population of clients, and they had mentioned now that they've gotten used to unmasking, when they have to mask, their other neurodiverse friends are like, I cannot look at you. Like, it's just uncomfortable because I just want you to be
I love that.
natural and unmasked. And it's true, because I saw and read in your program and your manual, we very much live in a neurotypical world. And I always explain, it's like, trying to have a square peg in a round hole. We don't all work in the same fashion.
Yes.
Yeah.
And I think one of the biggest challenge for neurodivergent clients is self-acceptance. Because, when you think about the concept of camouflaging, I don't even know if that really kind of really captures the experience of a neurodivergent individual. But it's more, so when you look at some of our assessments that we use, when we refer to the concept of camouflaging, it also kind of, there are different kind of factors, right? So there's what we call assimilation. So assimilation is when, your divergent clients make a lot of effort to compensate and fit in. And that can cause a lot of distress for the client and what we refer to now as autistic burnout, because of their effort to kind of behave like a neurotypical. And I see a lot of clients, especially women, where they say to me, Joseph, I don't really know myself anymore. So they assimilate rather than acculturate. So what happens in those kind of situations is they lost their sense of identity. They don't really know themselves anymore, because they say to me, every time I see a different person, my identity changes. Well, because it's trying to assimilate, right? So that's one. And then, of course, the kind of classic kind of camouflaging where, they make an effort to behave like a neurotypical, right? And that causes a lot of stress. I have clients where, let's say, there's a part of them that, kind of enjoys social interaction, but when they attend a party, they do enjoy the, kind of attending social gatherings, but the next day they feel drained. They cannot really function for the next few days. So that says a lot, right, in terms of how, it can really be challenging for a neurodivergent client to be functioning within a neurotypical society where there are a lot of expectations, not only by, neurotypical individuals in terms of neurodivergent clients, individuals' behavior, but it's also their own expectation of themselves. So there's a concept that, we refer to as internalized ableism, where they kind of, they internalized, norms and standards and values of a neurotypical society. Therefore, they will always feel different. They will always feel like, how come I cannot achieve my goal? Well, because, the goals that you're setting yourself are neurotypical goals, So that, that creates a lot of challenge for our clients. So.
Well, I love that, Joseph. There's so much I want to go into in all different ways in what you said, but I'll circle back to the program. But one of the things I absolutely love is that identity space of feeling like if they have to fit into a neurotypical world, it really challenges their identity of like who they are. And yeah, you might lose that sense of self space as well. So really important, which then I was thinking ties into what you've written into your program around a meltdown or a shutdown, and then the burnout and the stress. And I loved reading how a meltdown is the external way that someone copes, and then a shutdown is that internal way. And across other therapeutic modalities, that also makes sense. But I love that you wrote that in around the autistic population. Let's then circle around to the really amazing part and work that you both have done over the past year or few years. You've developed the Neurodivergent-Affirming Dialectical Behaviour Program. Now, DBT, I'm going to do it short because it's just easier. DBT was developed by Marsha Linehan primarily for borderline personality disorder, substance use disorders, a bit more complex psychology. Yes, we all have a love for working in that space as well. It's a little bit more structured. It has, it has the behavior analysis component, it has the emotion regulation component, interpersonal process or interpersonal effectiveness component, and then the distress tolerance. What prompted you to develop this specific program for the neurodivergent population?
Yes. So that's a very good question. So,
Joseph, I'll let you start.
yeah. So I've actually, my journey in the area of DBT has been quite, since 2006 when I had to adapt the program for individuals with cognitive impairment. So I've developed a program. It's an adaptation for using the dialectical behavior therapy with cognitively impaired clients. And then I've kind of come across, of course, the application of dialectical behavior therapy with autistic clients. And then I realized that, when you think about, what's really the evidence around, therapeutic modalities that work for autistic clients, you're looking at mindfulness, you're looking at social skills or kind of behavioral intervention, you're looking at, emotion dysregulation. And these are some of the core issues with autistic clients, right? And then when you think about dialectical behavior therapy, it addresses all of those issues, right? So it makes sense. And the good thing about dialectical behavior therapy is it's a coherent program. So it's not bits and pieces of different things. So that's one. Second, what I find really powerful with DBT is the fact that it's strengths based. So that's one. And second, it also focuses on what's this validation, which is kind of an issue with autistic clients kind of struggling to come to terms with kind of their own acceptance of themselves. So, and also the kind of, it highlights the issue around the dialectics between of neurodivergence, where, they want to maintain their kind of sense of identity, but they also function in a neurotypical society. So that the dialectics itself lends itself to kind of the use of the dialectical behavior therapy. So what happened was when I started getting involved with Can Miller Institute, where I run, I see clients for treatment at the clinic. I realized that I really would like to develop a neurodiversity-affirming dialectical behavior therapy program. So aside from Nimasha, I also worked with another professional psychologist with lived experience. So we decided to run the program together. We received feedback from the clients, which was so kind of very enlightening, really, in terms of, giving us feedback on what works for them. And then, of course, Nimasha and I crossed paths. And that's when, kind of the magic happened, right? In terms of us developing this program. So I was so excited. And of course, with any kind of, collaboration, you know how it's going to work. Yeah. But what was your experience so far, Nimasha?
Yeah, I mean, I was very, very lucky enough to get connected with Joseph when I was still in my
felt
title.
the same, Nimasha, don't worry, and I still feel the same
now. 100%. It was my gearing up for my final year of masters. Everything was pretty hectic, and I got in touch with Joseph through our mutual friend / colleague, Melissa Strang, and I was very, very interested in the concept myself. I had very much lived experience as an autistic person, also really benefiting from concepts of DBT. I really related to a lot of concepts of DBT as a clinician as well. I really enjoyed using them with clients. But at the same time, I could see the elements of it that way maybe well a little bit less neurodiversity affirming in terms of things like interpersonal effectiveness. That a lot of those skills are very neurotypical based, and just little bits and pieces here and there where I was like, there's a wealth of things to do here. And yeah, I had a really brilliant experience being able to do this and co-develop this program and be part of this while also simultaneously doing a very hard year of my final year of masters. So it was a very interesting dichotomy that I lived. But I had a really good time being able to, deep dive into some of the research, explore the nuances of some of these elements, kind of work with Joseph, and collaborate on sort of how to make skills more affirming, but also still like adhere to some of the core parts of them. And also just be able to like intersect some things that I had been thinking about, as you said earlier, like the meltdowns and shutdowns, and recognizing some of those elements. And yeah, there's a lot of nuances for them that I could talk forever about, so I will stop.
Oh, I love it. I love it. I know, same. I want to go in so many directions with the program because there's so much. But I really wanted to then ask you. So I think Nimasha, you mentioned that space of interpersonal effectiveness, and we were talking before how the program and the group that you run has like a component of the education piece, and in the interpersonal effectiveness space. Yes, a large part of building and maintaining relationships does rely on communication or how people communicate with each other. In the neurodiverse population is obviously a bit different. And I was reading through how you both even mentioned the double empathy problem. I might even actually leave it to you guys if one of you wants to explain the double empathy problem, because that actually also then will lead into what Joseph was saying. And, people need a level of validation, which is a DBT skill in itself, validation of others, validation of themselves. So can you talk through that double empathy problem that you've identified and you provide as education in one of your modules for interpersonal effectiveness?
Yeah, absolutely. Well, essentially, the double empathy problem is a piece of research that was discovered to kind of explore this misconception, and the very common misconception that, autistic people lack empathy and social skills. Um, and it's actually not true. The truth is, there's a lot more nuance to the subject than that. We, autistic people, we experience and express emotions, we communicate, we experience the world and relationships differently to non autistic people. And those differences can make it difficult for non autistic people and autistic people to understand each other. So basically, the double empathy problem outlines research that says neurotypical to neurotypical communication, generally on a broad basis, goes fine. Autistic to autistic communication, generally on a broad basis, goes fine. The disconnect comes from when autistic people and non-autistic people try to communicate, because there are functionally just different communication styles. And, as we've been talking about, society has historically normalized neurotypical communication. And so the benefit of the double empathy problem and the real validation that it can provide is recognizing that it's not about one neurotype being better or worse. It's just that these neurotypes are different, and we need to find modes of connection that are built off mutual understanding, reciprocity, and finding this middle ground. Joseph, part of the program Joseph and I have been creating is kind of recognizing the idea of like an assimilation versus an acculturation culture, which I might let Joseph kind of go into if you want.
Yes. So what's interesting with dialectical behavior therapies, we have to remind ourselves that it was really developed for neurotypical individuals, right? And therefore, we're mindful that, potentially it can be kind of invalidating and potentially also traumatic for individuals who've kind of underwent or, experienced behavioral interventions. And then when you look at interpersonal effectiveness, Nimasha and I felt like, this is not what really we felt it was really intended to if you're working with neurodivergent clients, right? So I guess the kind of the starting point was acknowledging that, there's what we refer to as the double empathy problem, and the reality that, there's different communication styles. Okay, acknowledging that there's a neurodivergent communication style and there's also a neurotypical communication style, and it's not like, neurodivergent style is any inferior, but it's just that it's different. And just to share an anecdote, it became really
Please,
kind of
yeah.
what's this apparent evident when we were running groups where Nimasha was because all of the individuals are all the participants are autistic. Nimasha has lived experience. She was talking about some of the jokes and some of the things that kind of they do on a daily basis, and trust me, I couldn't get the joke. I said I felt really left out because I said I can't really. Then both of them saying, "Yeah, I get you," that kind of thing, and it just made me feel, yeah, that's what it. That really highlights the difference. That if you're talking to another autistic individual is talking to another autistic individual, they get it because they have similar communication styles, and that became really evident in the session where it was kind of a very enlightening experience for me to have that kind of experience where I feel like I was feeling left out because I couldn't really I was trying to get my head around, of course, some of the communication because it's neurodivergent communication. So it made really a huge difference. And then we also looked at kind of the issue around the dialectics of neurodivergence, right? Where it's not about assimilation, it's about acculturation. So, in some way, we see, the kind of the autistic community as kind of it has its own culture, right? And therefore, like I kind of was trying to relate that with my own kind of culture, where when I decided to move to Australia, you know, I still have I'm a Filipino, right? And therefore, you have a choice of either maintaining some sense of your identity whilst kind of functioning in a Western society, and the same thing with autistic individuals, where it's kind of how do I maintain the challenge of maintaining my identity when kind of I'm in a neurotypical society. So that's kind of the process of acculturation. So.
I absolutely love that analogy or sort of crossover. I think we all can relate in some ways. We come with a different culture and you want to reserve parts of your identity and tradition as making up your own. So it just makes sense.